before my surgery, I did have a lot of bladder infections, and that was something that was driving me nuts because you know, accidents all the time, and I mean, to this day I know when I have an infection, but since the surgery, like more than half. I rarely get infections now. If I do, I pick on them right away. I know why. It's very, as long as when I'm doing the catheterizations, you're clean the same way that you do it normally. The area clean, catheters, a new catheter or a sterilized catheter. I haven't had any problems in terms of that. Infections, I still get them, just not as frequent. I'll get them once in a while, as opposed to almost once a month. Sometimes it was that bad. I've gotten to know my body. I've gotten to know my bladder, and I know it like the back of my hand. So my doctor knows. For example, I know when I have an infection because there's all these signs. You know, you feel like you have to go to the bathroom all the time, and when you do cath, there's nothing. Burning, that sort of thing. Sometimes I don't necessarily take antibiotics if I feel like I might have an infection. I just drink a lot and just cath a lot more, just to kind of wash it out and get it out of my system without having to take antibiotics all the time, because I hate doing that as well. So yeah, pretty much got that under control then.
I've been told that individuals with spinal cord injuries that catheterize always have a sort of low-grade bladder infection. So in fact, they just flare up occasionally. Maybe you get a different type of bacteria when it's particularly bad, or your immune system is particularly weak, or maybe you're becoming too lax around the protocols in which you're supposed to be catheterizing, like with what particular frequency. Usually when I get symptoms of a UTI, I'll have, there'll be odor, there'll be sediment, and elevated tone, and abdominal pain, lower abdominal pain. Sometimes I'll do a dip test. There are special strips that you can get from your urologist, or that you can buy in a pharmacy, and you dip them in your urine, and it tests for things like increased white blood cells, red blood cells, and other things. It usually tests for about 6 or 7 different items. There are some strips that are better and more expensive than others. You should usually consult your urologist in order to determine what the best kind is, and exactly which of the tabs you should be looking for, which have elevated levels, which would give you some sort of indication that you might have a bladder infection. I would also increase the frequency that I'm doing my ICs or catheterizing. Drink more water. If the pain gets to a certain point, but I don't think it's bad enough to warrant going to the hospital, I might take an aspirin, something like that, or a Tylenol.